Hello and welcome. Today we will be discussing the ASA difficult airway algorithm. We have a patient with a difficult airway and need to decide if we will intubate awake or asleep. To make this decision, we must consider difficulty of ventilation, risk of aspiration, risk of desaturation, and difficulty of emergency invasive airway using the mnemonic Vader. If the answer to all these questions is no, proceed with intubation after induction. If yes to any of these, proceed with intubation while awake. Let's discuss intubation while awake. Here, our clinical key is to optimize oxygenation while attempting other airway techniques, either changing equipment or personnel. Now, let's discuss intubation after induction. A failed intubation attempt brings us to our second decision point between the non-emergency and the emergency pathways. To choose between the pathways, we first assess mask ventilation. If adequate, non-emergency. If inadequate, place a supraglottic airway and reassess. Again, if adequate, non-emergency. If inadequate, initiate the emergency pathway. Here, the decision is all about ventilation. Let's discuss the non-emergency and emergency pathways. Both pathways involve trying other airway techniques. However, in the emergency pathway, this is done while preparing to place an emergency invasive airway. If the non-emergency pathway fails or the patient exhibits deteriorating ventilation, transition to the emergency pathway. Regardless of pathway, it is important to limit attempts at intubation. In the non-emergency pathway, our clinical key is to always consider awakening. In the emergency pathway, our clinical key is to be aware of the amount of time passed and to call for help early. In summary, for our patient with a suspected difficult airway, first decide whether to intubate while awake or after induction using the Vader mnemonic. In the case of failed intubation after induction, decide whether to follow the non-emergency or emergency pathway by assessing ventilation. Thank you for your time and attention. Check back for more helpful resources.